Hi, my name is Haley Wingo, and I am presenting a presentation on cleft palates. So, what is a cleft palate? A cleft palate is when the left and the right palate do not come together completely. It can come in different forms where the hard palate or the soft palate is not completely formed. And it can also occur where neither is formed properly. So, as you can see in this image, you see this baby who looks to be in a lot of discomfort. And as you can see that the soft and hard palate are completely split. And in this image right here, you can see what a healthy roof of the mouth looks like. And on this side, you can see where the soft palate is split. And it's important that SLPs and doctors do know the difference because cleft palates, like a lot of things, are not uniform. They do come and look differently, and with each different form, they're going to present different challenges for each of the patients. So that is something that definitely needs to be brought to doctors and SLP's attention. So, what are the causes of a cleft palate? Well, first of all, certain nutrients are needed to make sure that the baby develops properly. Folic acid, known as a B vitamin, for example, is crucial for a baby's development in the womb. In the early stage of gestation, folic acid is needed for development. You can get folic acid from prenatal vitamins or things such as drinking a glass of orange juice in the morning. The main thing is to have a healthy and rich diet. If you maintain a decent diet, then you should be able to obtain all nutrients that a growing fetus needs to develop their hard and soft palate. However, there are exceptions that even a healthy diet cannot necessarily fix. So, one of the main causes is genes. Genes are responsible for many things about us, and an abnormality like a cleft palate is not an exception. There are multiple different types of genes that can cause a cleft palate, like the CHD7 gene. Many physicians believe the main chances of having a baby with a cleft palate lies within the genes. Many doctors and scientists, however, are still figuring out exactly the chances with genetics are depending on what genes are present and the sequencing of the genes. Now, this means whether it's both parents that need to have certain genes or just one, or if there's certain genes that need to be combined together or other genes present. These things are going to definitely affect whether or not a child will have a cleft palate, and doctors and scientists are still trying to figure that out. But we do know that there is a definitive correlation between these genes and the development of a cleft palate. So that is definitely something that needs to be brought to the attention and to be aware of. So, another cause can be exposure during pregnancy. During pregnancy, there can be a number of things that can affect development. One cause for a cleft palate can be medication. Medications like anti-seizure, anticonvulsant drugs, acne drugs containing Accutane and methotrexate, a drug commonly used for treating acne, cancer, arthritis, and psoriasis, are also things like illegal opioid exposure, like heroin, can cause cleft palates to form as the substance harms proper development. Now, with this said, there are a lot of risk factors for mothers who have seizures or cancer, and it is important that they are communicating properly with their doctor about this if they become pregnant. And really, it comes down to a risk assessment. Each drug will carry different risks that some more than others, and also how severe is the mother's disorder. And it's up to the doctor and the mother to come together and decide whether or not to go off the medication option to maybe switch medications or decide to stay on. And so the main thing is just communicating with the doctor is the best advice that can be given because every situation is going to be different. It really is a case by case situation of whether or not a mother should or shouldn't get off these medications. How frequent is a cleft palate? Well, the frequency of cleft palates occurs together in one in every 1,000 babies, somewhat more than males than females, and about 20% have the cleft lip only, 30% have the cleft palate only, and 50% of children with a cleft lip will also have a cleft palate. Now, this is an important information to know because when treating a cleft palate, a speech pathologist will have a really great chance of treating a cleft palate and also a cleft lip. And so the awareness to the combination of those things, which are going to change the challenges for that child and what the SLP needs to be focusing on. So both are really important informations that are needed to know how to treat a cleft palate and a cleft lip together because it'll more than likely show up together at one point or another. Now, again, going back to the one in every 1,000 babies, now that number may seem small, but that means that it is more than likely that you as an individual will come across people who do have cleft palates in everyday life. Again, there are people who have their cleft palates fixed or people who have had heavy speech pathology or seen a speech pathologist. And these people will have proper speech, and you may have no idea that they have a cleft palate because of these early on interventions. So more than likely, you will come across these, and especially as an SLP, you will, because 1 in 1,000 actually isn't that low of a number. So speech pathologists do need to be heavily trained in cleft palates because they will at least see one case of a cleft palate throughout their career. So, speech. For most children with a cleft palate, speech most likely will be delayed. Not having a properly formed palate will make articulation hard, and I'll discuss that more in a minute. But between the ages of 12 to 24 months is when the cleft palate should be repaired. And the longer the surgery is held off, the more of a speech that will be delayed as well. So, but however, there is an alternative to that, which is an implant that can go into the mouth that can mimic a fully formed palate. And by doing this, this will allow an SLP to get in there and to actually start treating that child. An SLP can work with a unfixed palate. However, it is much more difficult. And the sooner that this is fixed, the better off that child will be in getting those early on speech building blocks that they need. So the sooner the better in this situation. And if the cleft palate is not repaired during the recommended time of 12 to 24 months, speech will more than likely will remain unintelligible to most people. How speech is affected. People with cleft palates often have a hard time catching their breath. And this is because people with cleft palates frequently produce nasal deformities that tend to reduce the size of the nasal airway. Approximately 70% of the cleft population have a nasal airway impairment and 80% mouth breathe to some extent. As you can see, a normal nasal passageway and then an obstruction. So to understand kind of what I'm talking about, one way to do is just to take your finger and to put pressure on one side of the nose. And as you can tell, my speech is now much more nasal, and I'm also having to breathe much more frequently from my mouth because I can't really get a proper breath of air through this one nostril. So this is just one way for an SLP to understand exactly what the patient is going through and how to treat them more with understanding a different nasal passageway. Articulation is another area of speech that can be affected. When a person is forcing their vocal folds together by force, they will often develop a glottal stop. A glottal stop is used as an alternative to stop consonants. For example, a person saying the words care instead of the words cater because that T is a hard thing for them to actually force out. And so that is something that SLP does need to be aware of and to maybe target a little bit more in their therapy sessions. So, what is an SLP's role? Well, before a child has their cleft lip repaired, a speech pathologist actually can step in and build different forms of communication. Many people believe that speech pathologists only deal with verbal language, but speech pathologists can help child form alternatives to speech to communicate. Examples of other forms of communication is gesturing and sign language. Simple things teaching a child like water, food, sorry, and thank you can give that child an early building blocks for language that can come into later when actual speech is put into place. And the sooner that that is done and given that child an outlet, the better off that child will be. So, another part of an SLP's role, as mentioned before, one of the main issues that a cleft palate can cause is issues with articulation. It is up to an SLP to teach how to pronounce these sounds that the patient previously could not, especially dealing with stop consonants like T's and D's. Teaching a child where the tongue is supposed to go, how the mouth is supposed to be formed to get that t, t, and that d sound, just getting the tongue in that right placement and getting that proper airflow and getting that mouth formations is something that SLPs especially need to target with cleft palates because the stop consonants are one of the most common things seen with cleft palates. So that is something that early on in therapy sessions that needs to be heavily addressed with these children. Things to be aware of with a cleft palate. Ears are often affected with this disorder and actually increase the likelihood of speech issues. Children who have a cleft palate will almost always have chronic otitis media due to interference with the musculature controlling opening of the auditory tube. If the auditory tube is not able to close properly, bacteria and liquid can enter into the middle ear space and purulent otitis media may occur, which is an infection requiring antibiotic treatment. If the muscles associated with the opening of the auditory tube are affected, the middle ear cannot properly aerate it. So, what does this whole thing mean? Well, in fact, if a child does not have good ears, especially from ear infections that aren't treated properly, their hearing is going to be affected. And so, a child that's already struggling to get words out, to get proper speech, is not even hearing properly the language that others around them are speaking. So not only are they struggling to get words out, but they're not even learning the words from other people around them, which will further delay them in the future. So it is extremely crucial that parents and doctors are vigilant about this and making sure they're looking for the signs of an ear infection. One of the signs can be grabbing of ears, fussing, fevers, and those things do need to be on a parent's radar when they have a child with a cleft palate. And one thing that is very common is actually for ear tubes to be put in place to make sure that things are draining properly within the ears and can prevent quite a bit of damage in the future for that child. Another thing to be aware of with a cleft palate is aspiration can very well occur in babies with cleft palates. Babies with cleft palates have specific feeding needs based upon unique anatomy and swallow physiology. Poor and absent inner oral pressure and compensatory muscle movements affect all phases of oral, pharyngeal, and esophageal of swallowing, and in some cases increase the risk of aspiration. Aspiration can lead to problems like pneumonia, which can be fatal for young babies. And so it is vital that parents are vigilant when feeding their babies with cleft palates. And it is often that doctors will come in and explain these things to the parents after the baby is born and show them what type of nipple to be using on a bottle, or maybe a position to feed the baby, or early signs of respiratory distress such as coughing or wheezing, things that parents need to be watching out for, because if these things start to occur, the sooner the parents bring them in to help treat the baby, the better. And that is the greatest thing that can be done for these babies early on to prevent any more discomfort or any more struggles for them. So these are the wonderful citations that I have used to help me create this PowerPoint. I have absolutely enjoyed this class very much, and I am very grateful for everything that I've learned. I'm looking forward to using everything I've learned in the future, and have an absolutely amazing Christmas. And thank you so very much.